Today we are talking about My Vaccine Record, which is a city-provided virtual platform for you to get a record of your recent vaccinations. So we're going to look at how to use that. We're going to look a little bit at some of the limitations of that. And then we're also going to talk about what it means to be up to date with your COVID vaccinations as of right now. It's just to sort of reinforce some of the things that we've been talking about in our community conversations and to make sure that you know how to assess whether you're up to date so you can get up to date if you're not. So using My Vaccine Record. So as I was just saying, My Vaccine Record is an NYC Health website. It's a city website where you can access a digital record of your recent vaccines that you have received that have been reported to the city health department. These are all the vaccines that the city has reported to the health department. First series of COVID vaccines and COVID boosters should be in there. There are some things that you might not see on there and we'll talk about. So today we're going to focus specifically on using this for finding out when your last COVID vaccine was to find out whether you are currently up to date on your COVID vaccinations. Okay, so a couple of things to keep in mind. There are some limitations to My Vaccine Record, so just keep this in mind. Healthcare providers in the city are required to report all vaccinations for minors to the city. So if you were using My Vaccine Record to access the vaccination records of a minor, it should have all the information on there, which is really helpful if you have a child or a grandchild that you need a vaccination record for. Vaccines for people who are 19 and older are reported to the health department with permission of the patient. Generally speaking, permission is something you sign off on when you're getting these vaccinations. I think that the initial doses of COVID were by necessity reported to the city, so they should be in there. Just know that if you were born before 1995, most of the records in there will be your recent records. You're probably not going to see things like your childhood immunizations, but that doesn't mean you didn't get them. This is just a really helpful thing for your most recent vaccinations. If you were raised in the city and all of your vaccinations as a young person were reported to the city, you might have all your vaccinations in there, but don't think just because something from many years ago isn't on there, it means you didn't get it. Because this is like a newish system, it's going to most likely have things that were recent for you, which is really helpful for us in assessing whether we're up to date with our COVID vaccinations. Okay, so let's talk a little bit about the 2023 to 2024 updated COVID vaccine. The reason that they updated the COVID vaccine is because the COVID virus has gone through a lot of different forms. You've heard about like the different variations that it's gone through. It's different than when the first 3 doses were recommended, right? So there have been these developments in the vaccine itself. For the 2023 to 2024 season, there's a new dose, and it's recommended that everyone ages 6 months and older get that updated COVID-19 vaccine. We'll talk about exactly how to know if that's the one that you got. Just a reminder too that anyone can become really sick from COVID, but the vaccine is especially life-saving for older adults, for people who are pregnant, for people with underlying health conditions that put you at risk of any serious outcomes, or that have certain disabilities that may increase your risk for underlying health conditions. So again, vaccines are safe, vaccines are life-saving. It's important that you get the most recent version of the COVID vaccine. If you got the initial series, you were well protected for that period of time, but now that the virus has evolved, you need to get this recent one in order to be up to date and fully protected. Again, just a reminder too that vaccination can reduce the duration and the severity of COVID-19 symptoms if you become infected, and it reduces the risk of long COVID, which is a really big part of this. Long COVID is still like a developing sort of set of symptoms that we don't know that much about, and anything that you can do to avoid getting these long COVID symptoms is in your best interest. So get this new vaccine. Okay, let's talk about knowing if you've had it. Okay, so what up to date means now is that you've gotten one updated 2023 to 2024 COVID-19 vaccine. If you've never been vaccinated, or if you have previously gotten a COVID-19 vaccine before September 12th, 2023, that's the magic date, you need to get one updated either Pfizer or Moderna COVID-19 vaccine. If your last COVID dose was before September 12th, 2023, you are due for one. So it's time for you to get the new one. Just so you know, none of these brands is preferred over the other. So it doesn't matter if you got Moderna or Pfizer last time, you can get either one. Whatever the doctor's office or drugstore that you go to has on hand is fine. Neither of them is recommended over the other. And this is a graphic by Les for our BRAVE project. Okay, some additional considerations. The CDC is also recommending that people who are 65 and older get an additional vaccine dose of this 2023 to 2024 updated COVID-19 vaccine 4 months after they got their first one. And so let's say you got your first dose in October, you can get it now because you would be 4 months later would be February, and we're past that. Also, people who have weakened immune systems. So if you are being treated for cancer, you've had an organ transplant, anything that weakens your immune system, talk to your provider about additional doses as well. You may qualify for some additional doses to make sure that you stay safe and protected. And then for children under 5, actually children ages 6 months through 4 years old, if they've already received 1 or more doses of the vaccine, they should receive the updated vaccine. So if their last dose was before September 12th, 2023, same thing. They should get 1 more of the updated. If it's a child that hasn't received the vaccinations, they're 6 months through 4 years old, they'll need between 2 to 3 doses in a scheduled series, depending on which brand it is. And the best thing to do there is just talk to your child or your grandchild's pediatrician and say, what is it they're due for? Or if you're going to a drugstore or somewhere like that, whoever is administering those vaccines should know what that schedule looks like. But just know that if you have a child of that age that hasn't been vaccinated, they will need 2 or 3 doses to be up to date and protected. Okay, so let's look at my vaccine record. So we're going to use this to figure out if we are up to date, right? So again, the magic number here is September 12th, 2023. If you've gotten a vaccination, a COVID vaccine, since September 12th, 2023, you're up to date. If you are 65 plus and it's been 4 months since you got that last one, you can get another one, right? And the CDC is recommending that you do. If you are immunocompromised, talk to your doctor. If you have a child that needs a vaccination, talk to your doctor. If they've already had their full series, they can get this new updated shot, okay? So those are the sort of rules of thumb, but we're going to look at this record to see when our last vaccine was, if we're due for another one, okay? So this is the My Vaccine Record website. It's all automated. It's not perfect, but there are many things that it can do, and it's really helpful. And it doesn't involve like waiting for a vaccine record, which is helpful. So let's look at this. All right, so this is just some information about it. They are presuming in some cases like this will be the most comprehensive record for children, but it's very helpful for adults too when it comes to COVID vaccinations. And so this is some of the information that we already went over, like what has to be reported to the city and what may not be. So what you're going to do is say yes, and then you're saying that you're the parent or guardian, or you are the person requesting these records. So you're just certifying that you're doing this, for yourself or for a child that you have a custodial relationship with. So you say, I agree to the above statement. For our cases, if we're looking for ourselves, we're going to say individual to whom the record relates. All right. And then it's going to ask us the information to find our immunization record. So this part's pretty straightforward. So first name, last name, birth month, birthday, birth year, sex, and there's multiple ones to choose from there, your phone number. And then it also asks, and this is not a required field, either your Medicaid number or your city immunization record number. So if you actually have your old COVID card or another immunization record, it should actually have that CIR number on it. You probably don't need to put it in here, but if you have it, you can put it in. And then there's this information about mother's first name and mother's maiden name. That is mostly presuming that you're looking up information about a child. So it's not required if you were born before 1996. So you can skip that. If you want to put that in to see if you lived in the city for a while and you might have your early records, that's fine, but you don't need to put that information in there. And then you're going to put your address, current zip code. And then there are 4 different ways for you to verify your identity in order to move forward. You can enter an ID NYC number. You would put your ID NYC card in there and agree to the above statement, and then it would let you move forward. Your New York driver's license number, so the one that's 9 or 10 digits, and it's at the top of your license there, so you can use that. Or you can just do, here's my phone number, and they'll send you a code, and you would just enter the one-time passcode in here. Or you do email, and they'll do it the same way. So they'll email you a code, and you enter the passcode just to confirm and keep this data safe. I'm going to pretend that I just filled all that out, right? And so if you go to next, what you should see is your result. At the top, you'll see all of your, identifying information, your name, date of birth, address, all that. And this is the immunization history. And I want to point out a couple things here. First, it has sort of spotty data for flu shot for me, because I have gotten them more frequently than this says. So I got one this year, I got one last year. Those don't show up on here just because they must not have been reported. Just know that I know I got those shots. This might not be the most reliable record for flu shots, okay? Because they're not necessarily reported to the city. What it is helpful for here is this is all the COVID shots I've received, right? These are all of them. So this was the first series, first 3. And then I got one in 2022. And then my last one was 10/27/2023. 2023, which is after September 12th, 2023, which means I'm up to date. Okay. So that's the one that you're really looking for. It's going to say something like, I don't know how to pronounce it, but it's going to be the most recent of your doses. You're looking for that dose to be after September 12th, 2023. If not, you are due for a new dose to make sure that you are currently protected against the variants that are out there right now. Okay. So if you run into any problems on the My Vaccine Finder website, like you get an error or anything like that, there's another form that you can use to request your records directly from the city immunization record office. So if something gets funky in the system, because it's not perfect, you can request your records directly. I'm not sure if they email them to you or mail them. They might email you a PDF, because I didn't actually have to do that because mine went through, but I know that there's a way to go around the system if you're having problems with it.